Welcome to the SAS Careers webinar organized through RCPCH. My name is Dr. Kumar Swamy. I'm a specialist neonatologist in Nottingham and also the chair of SAS Committee. I have Eslam here, who will introduce himself in a minute. And welcome to the first ever SAS Careers webinar through Royal College. Eslam, over to you.
Hello. Hi, everyone. I'm Eslam Edris. I'm a specialist doctor and general peds with interest in clinical hematology. I work in the Sheffield Children's Hospital and I'm a SAS committee representative for North East England, the RCPCH. So welcome, everyone. The UK, Kumar, we can start now, or you want to give more time?
Yeah, let's just start. Yeah.
Okay, perfect. So this is the SAS Career webinar, which is part of, if you are all aware, that this is the SAS Week that started from Monday. And there's a lot of activities that started either in the RCPCH or other Royal Colleges or BMA. So trusts also should start to celebrate this week, which is more, we give more time to recognize SAS doctors. It's not, I think, everyone aware about what is the SAS doctors and what is the SAS career. And that is the opportunity for us to discuss this further and give you more information about it. So we'll discuss a very basic knowledge about the SAS doctors. So in case you are still in the start of your career, you will be able to identify which pathway would you prepare for your future career. So the SAS stands for 3 letters, which are the S for specialty doctor and specialist and associate specialist. So there are 2 S and 1 A. So these are the grades which are currently under the SAS doctor contracts or grades. So the first one is the specialty doctor, which if you want to join this one, you need a minimum 4 years of specialty training or experience. This contract has got 2 types of contracts that are still working, which are the 2008 contract and 2021 contract. I will explain later in the next slide about the difference between both. But at the moment, there are still doctors on the old contract, which is 2008, and doctors on the new contract. Then there is a specialist grade, which is a new one that just implemented after 2021 contract, which got a minimum requirement of 12 years of experience with a minimum 6 years in the specialty, plus the generic capabilities, which are detailed on document on the NHS employee website and BMA, which include different aspects. We'll come to also put more links at the end for details about the generic capabilities. But it is mainly a sort of you are competent to work at a senior level autonomously. You are competent to work almost similar to consultant level, where you can have your own patients. So you have to demonstrate this to the employer or the Royal College that you have got this experience and this knowledge that include education, quality improvement, patient safety, training, and CPD, that you are able to work at this level, plus the requirement of the years of experience. And the last one is the A Associate Specialist, which is a closed grade at the moment. It has started, this grade is closed from 2008, and no new entrants unless some local posts that have been done by the trusts, but nationally it has been closed since 2008. And it is a similar, more of a senior role, more senior to the specialty doctor contract. And yeah, they can both act as autonomous level or in some parts as supervisor level as well. But there's no one can enter on this contract at the moment. They offered people on associate specialist contract to move to the new 2021 contract specialist. But yeah, it is by the choice of their doctors. Next slide, please. So for SAS contracts, as you mentioned, there was a major change in the contract by 2021. So previously, the 2008 contract has closed the associate specialist, and it was only the specialty doctor contract that was active and in force. So any doctor who want to join the SAS grade will go for the specialty doctor, regardless of his seniority or years of experience, because there's no other grades. And this grade has been, if you looked at how they started, they usually start with a minimum 4 years experience, then they can put you according to your either UK experience or overseas experience. You'll be kept on a pay scale, which we will show in a few seconds. And this will continue, you continue till the end of the scale, and then you stop at this point. So there was no progression beyond the end of the pay scale of the specialty doctor contract, which was part of the negotiations that started with the PMA, with the NHS employer, to get some more sort of progress, especially after closure of the associate specialist contract. And then it came the 2021 contract, which is different in the pay scale. They make the increment in the specialty doctor contract more faster, and you can get to the top of the scale in 12 years. And again, they increased the pay scale slightly from the old one. And then they created the specialist as a part of sort of career progression. So when you come to the end of the specialty doctor contract, you got the chance to promote yourself to a higher level. So similar to people when we go into training or into a locally employed post, and then they want to do either training at CCT or having CSER to move to a consultant contract, they started to put a specialist as a similar or alternative way. If you are not going through these pathways, you still got a chance to promote yourself, to move a step up, to be autonomous practitioner, and and you have a higher pay scale. Still, the pay scale is less than the consultant, but it is pretty close to that. So you start with this contract, which one of the good things as well that they started to put some on-call guards that you keep you like for the weekends on calls and long shifts. So there are some additional protective measures that the advisor in the national contract of the specialty in the new specialty doctor. And the only disadvantage in this contract is about the PA calculation. So if you know the PA, the programmed activity is usually 4 hours, and the normal hours, which normal hours in all the contracts was considered between 7 a.m. to 7 p.m. But in the new contract, they moved the normal working hours to be from 7 a.m. to 9 p.m. Additional 2 hours. During all this period, the PA is calculated as 4 hours, and the premium time, which is from in all the contracts 7 p.m. till 7 a.m., this will be counted as 3 hours for the PA. And in the new contract, it started from 9 p.m. till 7 a.m. And then any hours over the weekend or bank holiday is also considered as premium time. So this is the main disadvantage of the old contract. But the other parts on the negotiation, I think we're in favor of the 2021 contract. And people started to move gradually from the 2008 to 2021 contract because it started to give them more benefits in terms of the salary and the pay scale. Okay, next slide, please. So I'm not sure if this is very clear for you, but this is the old specialty doctor contract, which has been like over almost. This is a comparison between both the old specialty doctor and the associate specialist, and you can see the progression is actually through 17 steps. So we have to stay 17 years to reach the top of the scale, which is like 98 plus, and the associate specialist, it starts at 74 and ends up at 121. So the time which one of the parts that they start to act on, that 17 years is too much to do from the first till the second till the end of the contract. So if you can see the next slide, please. In the new contract, we started to shorten this period. So for the new specialty doctor, which is the one on the left-hand side, is we came to 12 years. So after 12 years, you'll get from the top till the bottom of the contract, till the end of the contract. So 99, it ends at 99.2, and start at 61. So the start salary has gone up and the end slightly up, and they shorten the period that you get through to 12 years instead of 17 years. And then the specialist contract, where we find the start salary is 100,000.87, and then it goes up to 111.4. And this can go up to in 6 steps rather than 17 steps. Still, the associate specialist in the contract, our higher salary is higher, but the start is here much higher. So they try to make the specialist as a progression. It starts where the specialty doctor ends. So as they end at 99, then the start of around 100 plus for the specialist contract. And this is what like good point that makes people can get really a good career progression and the new contract by moving from the specialty doctor to the specialist contract. Next slide, please. So people, how common is the SAS grade? You can see this is the statistics from the Royal College workforce data, where you can find this in the our RCPCH website, where you find the percentage. As you know, the SAS and the consultant are the main substantive force in the trust. You can have some temporary posts, which are in the forms of local employed doctor or local consultant, but the main force or substantive force of the trust is composed from these two big national contracts, which are the SAS contract and the consultant contract. And in England, this is in the dark blue color is the consultant numbers. It's by head count, like, so this is by number of people are working in the trust. So through the years, you can see, and the light blue one is the SAS doctors. So still there's a very big gap between the number of the consultants and the SAS doctors. And this is mainly prominent in England, which reflects still people are not aware about this as a good career choice. So still the number is around 20% almost compared to the number of consultants. But we still, I think, aim to increase the people awareness about this career and how to join this, which will help us to move this number higher in the next few years. Can go to the next slide, please. So in the next one here, you can find this data from Scotland, where you find higher number probably of SAS doctors. So they are compared to England, they are higher in number compared to consultants, which reflects again they are making use of this contract and enriching the workforce and getting more numbers from the SAS contracts. And I think in the next slide, and we get the data from Wales. Can you get the next slide, please? Move the next slide, please. Hasn't moved yet. Oh, yeah, moved 2 slides. So there was another slide, I think, before that. Yeah, so this is the data from Wales, which is the last data available to us, where here you can see we are almost approaching near to 50% of the workforce are divided between the 50% of the consultant number almost. So the number here is much higher, which reflects that really Wales are making good use of this, which we hope to reach this percentage in England as well. We still don't have good data from Northern Ireland, but these are the data that are available, and you can find all this data in the RCPCH website. And so we hope to get better understanding of the SAS contract and how to make use of it and how to push, either if you are a local employed doctor and you trust to push to get into one of the SAS contracts, or if you are still a medical student thinking about the specialty of pediatrics, then you know that there are different pathways. So you can get some experience and go into SAS, and you can get into the training. So you've got different options where you can, if you want to achieve your specialty of interest, if pediatrics is one of your choice. It's again in all specialties, but yeah, we focus here on pediatrics as part of the RCPCH. But this will help you to get a different pathway if you think that the training can be difficult or challenging for you. There's a lot of SAS doctors who have been in training and dropped off because of more of family or personal reasons. They're not able to continue, then they move to the SAS career and they start to progress from there. So just keep it in mind as a good viable pathway for your career. Okay, thank you. I'll hand over now to Kumar.
Thank you, Eslam. That's very informative, and hopefully it'll help the people who have joined. So on this SAS Awareness Week, which you might have seen lots of posts and tweets from college and from our college and other colleges. So it is to recognize and appreciate the work all the SAS doctors are doing. And I want to tell you my story, how I became a SAS doctor. So basically, I did in those days, there was 2 years of SHO training, which was compulsory to take clinical examination, which I did. And after which I became a clinical fellow in neonatology at the registrar level. For 2 years, a year in Nottingham and a year in Leicester. So I'd done quite a bit of neonatology by then, and I was always interested in, procedures and hands-on skills. So I approached my head of service and said, "Oh, I've done neonatology for so long. Can I be made permanent? I would like to stay in Nottingham," and they were quite receptive to that and supportive of me becoming a specialty doctor, which I did 10 years ago. And then I worked as a specialty doctor for 10 years. And in those 10 years, I developed my own niche skill set and became leads for quite a lot of things, which I will mention in the next few slides. And when I had picked all the generic capabilities framework, which is, as Eslam said, is available on our Royal College and NHS employers and BMA. I went back to my head of service and said, I would like to be considered for a specialist grade. And I had to meet quite a lot of generic capabilities, which I did. And where I was short of, I did those and became a specialist. And I've been specialist for 4 years now. And I must say that my department has been quite supportive of me becoming a specialist. Next slide, please. So in terms of career pathways, there are different ways of choosing what you want to do. You can stay a specialty doctor for as long as you want until you retire. You can become specialist if you meet the criteria, which is 12 years, as Eslam said, and also meet the generic capabilities framework. Or you can go through whatever portfolio pathway, which was previously called Caesar, and become enter into specialist register and become consultant, or you can re-enter training. So there are different, depending on your experience, there are different levels where you can re-enter training. Next slide, please. In terms of opportunities, there are lots of opportunities. You just need to keep an eye out for them and grab the opportunity when it comes. show your hand up and say yes to everything if we can accommodate. So there are departmental opportunities, there are trust-wide opportunities, there's personal skills which you can see as opportunity and also career progression. Next slide, please. So in terms of departmental opportunities, you can develop your role within your trust, which I did. So basically, you can get involved in lots of audits, service evaluation, which I'm sure many of you will be involved in already. Writing guidelines. I've written 8 guidelines so far, and as first author, and your name going on the guidelines definitely has an impact on if you're being considered for specialist. Changes in clinical practice. If there's any projects which is going on in terms of changing the practice within your department, wherever you work in pediatrics, you can get involved in that. You can become leads for attain newborn examination, NIP, which is the newborn examination, or postnatal wards. There are lots of MAT-NEO projects which is going on for a few years now, and you can get involved in those. And a lot of SAS doctors think that they can't get involved in research. That's not true. You can become principal investigator for research studies, and I've been PI for 3 research studies so far. And you can also get involved in service improvement projects. That's something which I feel is very exciting. If you make a change and improve the service, getting involved in a project definitely has an impact and on your career, and also helps the department as well. And you will be recognized much more in terms of you're active, you're involved in all of this governance and improvement projects. Next slide, please. There are lots of trust and NHSE opportunities. SAS doctors can become educational supervisors, appraisers. You can become SAS tutor. I'm SAS tutor for my trust. You can become SAS advocate and also sit in local negotiating committees as SAS rep. I know quite a few people have become service leads. So heads of services can be led by SAS doctor. You can become locally employed doctor lead. There are some SAS doctors, senior SAS doctors who have become medical directors for the trust, and there are associate dean for SAS doctors and LED doctors within the NHSE as well. So there are lots of opportunities. You just need to keep an eye out for them and go for it if that's something interests you. Next slide, please. There are obviously lots of college opportunities as well. So volunteering opportunities. So unfortunately, it's an unpaid volunteering opportunity, but definitely, sitting in SAS as a regional representative, you can become a committee member, and you can also become a chair, just like me. There are lots of SAS representatives on other committees as well, like CSER or Portfolio Pathway, Education Committee, Membership Committee, and the different committees which has SAS representatives. So you can get involved in those as well. Apart from that, SAS doctors can become college examiners, DCH examiners, and we are looking into making SAS doctors examiners for RCPCH as well. Next slide, please. Work-life balance wise, personally, I feel it's a better work-life balance. It works for me. I get a lot of time off. I work less than many of my consultant colleagues, but get paid almost the same as them. It's a career choice. So if it's something which works for you, then definitely consider becoming a SAS doctor. As I said, it's a better work-life balance. And opportunity-wise, you get equal opportunity as a consultant. So if there's a job which is advertised for a consultant, you should be given an opportunity to apply as well. So that's nationally agreed, and a lot of these trust jobs and trust level jobs and national jobs are advertised for both consultants and SAS doctors now. And definitely there's opportunity for flexible working, both in training and in SAS career. So that's something which is quite attractive to a lot of SAS doctors. Next slide, please. These are the useful links. So if you go to Royal College website and type in SAS Doctor in the search, you'll get lots of information, and we have developed job planning toolkit, and it tells you all the opportunities in the college, how to become a member, and the generic capabilities which we were talking about to become a specialist is also the link is also on the Royal College website.